Dr. Kevin Jefferson here, back at the National Medical Association Annual Convention and Scientific Session in New Orleans, Louisiana. I'm here with the one, the only Dr. Roger Mitchell, pathologist extraordinaire, former chief medical examiner
That's
for the
right.
District of Columbia. And Roger, first of all, thank you for joining me, man. Yeah, you've been a big brother to me since I've joined the NMA about 7 years ago in DC, man. You're doing great things. Roger now serves as a Speaker of the House of Delegates for the NMA.
That's right.
Roger, what is up?
No, man, Kev, it's great to see you, man. Your setup is looking kind of fresh right now.
Yes, sir.
You done come up, you got new
Yes, sir.
microphones. You know what I mean? And it's great to be in the building with you, man.
Yeah.
The National Medical Association is the premier organization for physicians, whether you're black or anywhere else, right?
Mhm.
But we've been around for a long time, since 1895, really providing that voice for the voiceless and
Right.
being that space. So my first year as Speaker of the House of Delegates, that is, some say, the most powerful position of the National Medical Association. That's what they say.
That's what they say on Capitol Hill too, don't they?
That's what they say. But we run a meeting and really run the governing part of the organization.
Right.
Understanding, whatever initiatives that are being put forward by the members that need to be adopted by the organization come through the House of Delegates. And my job as the speaker is to make sure that meeting moves smoothly. So I'm enjoying it. And I'm having a good time. I'm here representing Howard University as well. And it's good to be here in New Orleans.
Okay. So what's going on at HU? What are you doing up there right now?
Well, at HU, I'm the chair of pathology at Howard University, and I'm also the chief medical officer for adult ambulatory care. And so we have about 28 clinics, over 110,000 patient visits, and my job is to ensure quality and safety for our patient and make sure that we have a good physician experience and support the physician enterprise, hiring and recruiting of physicians and supporting our physicians as they come into the practice. And then as the chair of pathology, making sure that laboratory medicine is solid, that we have the right diagnostic tools, and quite frankly, moving into this new space of digital pathology and artificial intelligence.
So I'm very proud of seeing you come up the ranks, man.
Yeah, man.
Because we were just put soldiers at
That's
Red
right.
Kai
That's right.
together
That's
in
right.
DC. But you've always been in that position of leadership as the CME for DC.
That's right.
You've dealt with a lot. You dealt with a lot of stuff that's been in the news.
Yeah.
You've been in stuff not just locally in the district, but nationally. You've been part of some pretty national cases that people are aware of.
Yeah.
And doing studies on those cases and actually doing exams on those nationally recognized cases. So tell us how your training and your upbringing as a pathologist has prepared you for this moment here in the NMA and what you're doing now.
Well, I mean, as a pathologist, we see all corners of medicine. As a forensic pathologist, we see, good policy and failed policy as it relates to healthcare delivery on our table. And so I think pathologists are uniquely positioned because of our understanding of all facets of medicine to be physician leaders. And so, I have a natural inclination towards leadership. And so, I'm using those natural talents to be able to move our organization forward and also to serve our community in a way that leads to health equity and leads to freedom, quite frankly. And so I'm excited about being in this position. The last high profile case that I was involved in was the LaShawn Thompson case. He was a 30-something-year-old man in Fulton County Jail. He was allowed to be malnourished. He was allowed to acquire body lice, thousands and thousands of body lice on his body. He was filthy, and he was malnutritioned and dehydrated. And the Fulton County medical examiner at the time called it undetermined. And I got involved when Ben Crump called me and Colin Kaepernick's Know Your Rights camp reached out to me and said, Dr. Mitchell, will you take a look at this case of death in custody? What conclusions can you come to? And I reviewed the case over about 6 or 7 weeks and found that he actually died from complications of severe neglect. And I called it a homicide because he was a schizophrenic that required the care to be delivered to him. There were no schizophrenic medications in his system.
Wow.
And I'm telling you nothing that's not in the national news, right? So, and what's interesting, Kevin, is that the Department of Justice on July 13th, 2023, made the decision to then investigate the conditions of the Fulton County Jail. So the work that we did has led to an investigation into the conditions of the jail that functionally let a man die. And so that's the work that I'm doing in forensic medicine now, a lot of death in custody work, and making sure that these diagnoses that are happening across the country are accurate and reproducible.
Another thing I need folks to understand what you're all about, and it's become your passion project, is violence, gun violence in particular, deaths in custody. Now, I'm a podiatrist.
Sure.
I've dealt as a podiatrist with a lot of gun violence myself.
Sure.
Not nearly as much as you have. But I've dealt with it on the medical side. I've dealt with it on the personal side. I've lost 2 nephews to gun violence.
Wow.
Right? Up in Baltimore. And as a surgeon, I've come down to Howard plenty of times to remove bullets from folks, whether it be accidental or victims of crime.
Sure.
Or repaired broken bones from people jumping out of windows to escape gun violence.
Sure. Sure.
Right. So we know it's an ever perplexing problem, not just societal issues, but on the political side. And I've watched you speak a number of times in a number of forums on this issue.
Yeah.
Not just here at NMA, but on Sirius XM with Karen Hunter, with Steve Harvey show. If you guys haven't seen him, Google him on when he was on this guest on the Steve Harvey show, and the number of times he's been on the Karen Hunter show on Sirius XM. Powerful stuff there. So what do you think we as a body, as an NMA, right? Because as a foot surgeon, foot and lower extremity surgeon, I'm tired of fixing the foot bones of 17, 18, 19, 25-year-olds
Sure.
from gun violence who survive, but some of them end up with lifelong injuries.
Sure.
Right? Not to mention how it messes with the mental.
Yeah.
Right? If they happen to survive, and what it does to families and communities for those who don't.
Yeah.
So how are we as a body, as a National Medical Association, what should we do more to address this issue, bring it to the forefront? You've done a lot of work on policy, on the deaths in custody form. Talk a little bit about that, and then we'll get into the book.
Well, listen, when, like you said, we came up together in this organization, right? I started in this organization in 2014, 2015.
Right.
So, for the last 9 years, we've been developing a platform for violence prevention related programming, discussions, policy changes, press releases, activities during national convention, and all those were under presidential task force mandate. Well, just last year, a council was developed councils are part of our bylaws and standing entities within our organization. And so there's now a council on violence prevention at the NMA. Huge win. We just left a plenary on that. And so now it's to really stop just talking about it, but also mobilizing health justice, mobilizing health justice when it comes to violence prevention and developing programming. I just gave a charge to the Council on Violence Prevention for them to create a book of all the best practices for violence prevention in the country, and put an NMA stamp on it, so that we can issue that book to individuals that want to do violence prevention programming nationally. And I think that's what we need to do. We need to make ourselves available to understand and study this issue. For the last 30 years, it hasn't been studied. Just recently, there's monies being put in the Centers for Disease Control and the National Institute of Health to be able to study violence as a gun violence, particularly as a public health issue. So the NMA and its members, we need to put in grants to study the effects of gun violence and be the providers of these types of research. And then we need to talk to our patients about access to guns and safe storage of weapons, and how they feel about guns. We need to be opening up our conversation because we know the number one killer of black males ages 10 to 34 is homicide. And so that's extremely important for us as the National Medical Association to be the experts in the voice for violence prevention. Now, as it relates to death in custody, man, I've been looking at death in custody as a public health issue since 1999. I remember when I was a student in the Student National Medical Association, I wrote a paper on police brutality as a health issue, and I think I was one of the first to write on it. And since then, as a result of the killing of Amadou Diallo, he was shot at 42 times, 41 times, hit 19.
Yeah, I was in New York at that time. I was a resident in New York at that time.
Listen, he had entrance wounds in the soles of his feet, Kevin.
Yes, sir.
That means he was on his back when he was shot. That changed my life. We were functionally the same age. You know, he was born in 75. I was born in 74. And I said, wow, you could be reaching for your wallet in the vestibule of your home and shot and hit 19 times just for being black. And nobody went to jail for that. Like, that was okay. That's craziness to me. So I've been looking at death in custody as a health issue since then. And I connected with a good brother, Jay Aronson, from Carnegie Mellon. And we started talking about how we could come together to talk about writing a book. But before we started writing the book in 2017, but before that, I was advocating and talking through and learning, right? Becoming an expert in death in custody. I was on the shooting task force for the state shooting task force for New Jersey, where I learned a lot about how law enforcement discharge their weapons during apprehension. So I've been a student of death in custody for a long time, and now we have the opportunity to impact how the American public thinks about it.
So what people need to also understand about Roger and his passion for this line of work is that recently, probably in the last year or so, maybe say that violence and gun violence as a public health issue has come to the fore. You're seeing AMA talking about it now. You're seeing them having, articles and exposés about it on CNN and whatnot. But Roger and the NMA are responsible for putting that from the back burner, or not even on the stove, to the front burner now. It's just, and we need to understand how grateful we are, and definitely how I am, to have you in that position to bring this issue forward. That we just can't talk about it in our meetings.
That's right.
We got to take it out of these hotel walls.
That's right.
And into the halls of Congress where you've spoken.
That's right.
Into the streets and in front of little kids all the way up to our nation's leaders. And man, I look forward to see what's going to happen next. I'm always there for you and serving with you, not only in DC, but here nationally at the NMA. Let's wrap about the book.
Hey, so the book is Death in Custody, How America Ignores the Truth and What We Can Do About it. It's available on all your platforms, Barnes and Nobles, Amazon, Johns Hopkins Press. Those that listen to your podcast, if you put in the code HTWN, you can get 30% off of the book right now. And functionally, it is a series of stories surrounding individuals that have died in the custody of law enforcement, but also the journalists, the advocates, the activists, of how they brought those stories to light, and how the government has been officially ignorant about these deaths. We start off with a chapter on Ida B. Wells and her work on lynching, and we make the connection that death in custody today is very similar to lynchings of yesterday. We also talk about how medical examiners have often been complicit. During the lynching era, medical examiners called those lynchings deaths at the hands of unknown persons. Really? Hundreds of people gathered around burning black flesh, and no one knows who killed them, right? Well, the same thing is happening today. 5, 10 people on the back of a black man, and he died from sickle cell trait, or he died from asthma. You know, these are the types of, and the manner of death is undetermined. It's unacceptable. And so we're calling it out.
Yes, sir.
We're calling it out, and we're suggesting that the Department of Justice should not be the only federal entity that's responsible for reporting and categorizing these deaths. We suggest the Centers for Disease Control should be categorizing these deaths. The Centers for Disease Control publishes a U.S. standard death certificate.
Right.
That death certificate is used on every single death. And so if we can learn how many women are dying in and around pregnancy, right, called maternal mortality from the death certificate, we can learn how many people are dying as pedestrians struck by motor vehicles or drivers in automotive accidents. If we can determine that people with cancer were smoking at the time that they were diagnosed with cancer, all of which is on the death certificate, then we can use the death certificate to establish whether or not someone died in custody by putting a checkbox that says yes or no, death in custody. So that's the bottom line of this book. We ask for fatality reviews, national fatality reviews as a public health measure that we know works. We ask for other public health measures. Really, really excited. You know, Brian Stevenson blurbed the back of the book, and he said, this timely, important, and well-researched book shines a much-needed light on the epidemic of preventable and hidden deaths in our nation's prisons and jails. It's impossible to read it without demanding that policymakers address the lack of data, the lack of oversight, and the lack of humanity in these dark places. And that was from Michelle Deitch. You know, Brian Stevenson said, Americans' prisons have become death houses for so many people who have tragically lost their lives as a result of neglect, abuse, and mismanagement. This critical, important work shines a powerful light on a public health emergency created by our nation's addiction to incarceration and extreme punishment, an urgent, compelling, and necessary call to action we should all embrace. So we believe that, you know, if you read this book, you get this book, you'll be that much smarter to advocate and activate surrounding death in custody.
So to close, man, what should we as NMA members individually in our practices, in our hovels, when we're talking to our children, we're talking to our patients, we're talking to our communities, look, tell them what they need to do.
Well, I mean, at the end of the day, we want to educate ourselves about violence and the types of violence that we have in our community. We want to make sure that we understand that violence is a public health issue. And it's a public health issue because we need all of the resources to solve it as a problem. That means that we need our business people, we need our preachers, and we need our preachers, and we need our imams, we need our rabbis, we need our community members, our physicians, our police officers, all to understand that we play a part in preventing violence in our community. And as it relates to death in custody, well, death in custody can show its form in homicide, suicide, accidents, naturals, or even undetermined. And so we need better data. And once we collect that data, then we can be able to start solving the problem of prevention. So thank you so much. I appreciate you, Kev.
Man, good looking out, brother.
Thanks, man. I appreciate you, man. And once I got a copy for you, man, I'll sign it and give it to you.
That's a bet. That's a bet. I'm
Yes,
looking
sir.
forward to it, brother.
Appreciate you, man.
Again, Dr. Kevin Jefferson here. Dr. Roger Mitchell, we're at the National Medical Association annual convention here in New Orleans, the Big Easy. Having a good time, learning a lot, discussing a lot, and setting path forward for what we as an organization and what we as a people need to do for our people. So we'll check you on the next go around. Peace.